Welcome. This is the last subsection of this presentation by defects in prenatal diagnosis. In this, we'll take a look on various prenatal techniques that are used to diagnose the birth defects before the child has been born. In this, we'll take a look at ultrasonography, maternal serum screening, amniocentesis, and chorionic villus sampling. So, ultrasonography is relatively non-invasive and it is very commonly used. It uses high frequency sound waves, so it bounces off from the fetus, from the uterus, from the environment, and help to construct the conditions that are being seen within the uterine cavity. The approach may be transabdominal, that is through the abdomen, or transvaginal, that is through the vagina. The technique is very safe, no known side effects, and it is routinely used to monitor the development of the fetus during pregnancy. Various parameters that are revealed by ultrasound are fetal age and growth, how old is the fetus, how old is the pregnancy, and how is the fetus growing, the presence or absence of congenital anomalies. It is usually done at 20 weeks of pregnancy, and if an anomaly that is incompatible with life has been found, the gynecologist usually recommends termination at this stage. The status of the uterine environment, is it feasible, is it not feasible, amount of amniotic fluid, lesser, greater, normal, the placental position and umbilical blood flow, placental position, placenta previa creta, and umbilical blood flow, is it normal or not? So, in order to measure the fetal growth, crown rump length, which is the length from the tip of the head to the tip of the buttocks, is used during 5th to 10th weeks of pregnancy. After that, a measure of a combination of biparietal diameter between the two parietal bones of skull, the femur length, and abdominal circumference is used. So now maternal serum screening. There are various markers in the maternal serum that can be used to screen for pregnancy. The most important one is alpha fetoprotein. It is formed by the fetal liver. It peaks at approximately 14 weeks, increases during the second trimester, steady decline over the third trimester. In case of defects like neural tube, defects, for example, anencephaly, omphaloceal, already told you, ventral body wall defect, usually to the right, in which the physiologically herniated intestinal coils do not return back into the abdomen, gastroschisis, abnormality of the ventral abdominal wall, in which abdominal contents herniate out through an opening in the ventral abdominal wall. In all these conditions, alpha fetoprotein usually increases. So, in case of defects like Down syndrome, which is commonly seen, trisomy, various trisomies, or triploidy, alpha fetoprotein usually decreases. So other maternal serum markers are human chorionic gonadotrophin and unconjugated estriol. These are used for identification and progression of pregnancy. However, alpha fetoprotein is the most important marker that is used to monitor the pregnancy, and can also be found elevated or depressed in various pathological conditions. Now we have amniocentesis. In amniocentesis, what do? We insert a needle transabdominally into the amniotic cavity. Here you can see this is an ultrasound probe that is being used to view the amniotic cavity. A syringe is being inserted through the abdomen into the amniotic cavity. 20 to 30 ml of the fluid is drawn. It is not performed between 14 weeks of pregnancy. Now, why may that be? Because at that time there is a very little amount of amniotic fluid within the amniotic cavity, and taking out 20 to 30 ml may be devastating. It has 1% risk of fetal loss. That is when human error is not being included. The fluid is analyzed for alpha fetoprotein and acetylcholinesterase. Now, the sloughed fetal cells in the amniotic fluid can be used for genetic analysis. However, the harvested cells are not rapidly dividing. So, what do? We add a mitogen. Now, what is a mitogen? Mitogen is an agent. Mitogen may be nutrient. Mitogen may be any agent or a nutrient that helps the cells to divide. It provides nourishment and food to the cell and a suitable environment that causes the cells to rapidly divide. As a result of which, cell culture is usually delayed. So, the next technique we have is chorionic villus sampling. What do we do in this? It involves inserting a needle transabdominally or transvaginally into the placental mass. So again, this is the ultrasound probe, and this is the needle. Now you can clearly see this is a transvaginal needle that is being inserted, and now the needle is inserted within the placental mass, not in the amniotic fluid. One aspirates about 5 to 30 milligram of the villus tissue from within the placenta. Cells may be analyzed immediately. However, the accuracy is problematic because placental cells are rapidly dividing. They may be at various stages of division, as well as they're cells with multiple nuclei. So it becomes very difficult to form an accurate diagnosis. So, in order to form an correct diagnosis, cells from the mesenchymal core are isolated. It requires 2 to 3 days. However, with this technique, there is a twofold increase of fetal loss as compared to the amniocentesis. There's also a risk for limb reduction defects. With this, we conclude our presentation. In the last subsection, we talked about various diagnostic methods that can be used to detect birth defects before the baby is born. The reason of using this technology is that there are certain birth defects that are not compatible with life. Pregnancy, though it may be a gift, it can also be a burden. One should always make the right choice and abort if a certain life-ending life or life-threatening condition has occurred in the fetus. It's better to terminate it at that time than to give birth to a child with abnormalities and give him or her a very difficult life. In all these matters, always talk to your doctors for the best opinion. Always confront your faith and always make the right decision with the help of your elders, with the help of your faith, and with the help of your doctors. Thank you for watching sqadia.com. There are a lot more lectures like this from where this comes from. I hope you like this lecture. Keep watching. Thank you. Allah Hafiz.